Good afternoon. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're very excited that you have joined us today for the California State Loan Repayment, or SLRP, program technical assistance webinar. Before we begin, I would like to discuss a few housekeeping items. First off, our webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the view controls and the chat feature at the top of your screen with the icons. Number two, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. Today, the chat option will be open during the presentation, and we will answer them in our Q&A session, which is at the end of this webinar. And lastly, the slide deck is posted on our website, and a link can be found in the chat box now, along with all of the other resources that we're presenting today. And with that, I am thrilled to introduce our presenter today, Daniela Perez, Program Officer for SLRP.
Thank you, Chris. Good afternoon, and thank you for joining us today. My name is Daniela Perez, and I'm a program officer for the State Loan Repayment Program, SLRP. So I'll be walking you through the SLRP program's guidelines and application requirements. So feel free to ask any questions in the chat, and we'll be responding to those questions towards the end of the webinar. So let's go ahead and get started. So the SLRP assists with the repayment of educational loans for healthcare professionals who commit to serving in federally designated health professional shortage areas, known as HCAIs, or at federally qualified health centers, FQHCs. So this is a program that is funded by both federal and state funds. So a few important dates to note for the SLRP. So the application cycle is currently open and will be open until September 15th at 3 p.m. So we will begin to notify applicants of the award decision in December. Again, the application is open now and will be open until September 15th at 3 p.m. So a couple of things to note for this new cycle. So if you are attending this webinar as a continuation grantee, there are a few changes that are occurring this cycle. Most of these changes took place during last year's cycle, but these are still some important changes to note. The most significant change is that this is a no-match cycle, meaning that no match payment is required from eligible SLRP practice sites. Since it is a no-match cycle, applicants will not be selecting their site from the SLRP approved site list on the application. Instead, applicants will just enter their site address and we will verify the site's eligibility as part of the review process. Applicants will also be required to submit a completed employment verification form, also known as an EVF, as part of the application process. So please keep in mind that both the applicant and the site administrator will need to sign the EVF. So there are a few major points that I want to emphasize on this slide, which these slides will be made available in the coming weeks, but do keep in mind that you can also find this information on our SLRP grant guide. But a few requirements to pay notice to, the first one being that you must be a U.S. citizen, U.S. born or naturalized in order to apply to the SLRP. You must also possess a current unrestricted license to practice in California. You must also have no other existing commitments or service obligations to any other entity. So you cannot participate in two programs at the same time. Keep in mind that you may apply to multiple programs offered through HCAI, but if you are offered to participate in any of the programs, you will need to choose one program to participate in. You cannot participate in multiple or two. You can only participate in one program. You must also be currently employed or have accepted employment at a SLRP approved practice site. So in order to be considered for the SLRP award, you must confirm that you fulfill all of the requirements on this slide. All right, eligible professions. So here's a list of the eligible disciplines for the SLRP. I won't be going over each discipline right now, but please remember you can find this list on the grant guide, which will be provided to you in the chat. It can also be found on the SLRP website. And as a reminder, you must be currently licensed, meaning that associate positions are not considered an eligible discipline under the SLRP requirements. We will be asking for a copy of your license as part of the application process. All right, work requirements. So you may apply as either a full-time or half-time applicant. The hours required and the award amount does differ between the two, and I will review the award amount in just a moment, but to go over the major work requirements, a full-time grantee must work a minimum of 40 hours per week. Even if your workplace considers less than 40 hours to be full-time, per the SLRP requirements, you must work a minimum of 40 hours per week. 32 of those hours must be spent providing direct patient care. The rest of the time may be spent in an administrative capacity or spent performing practice-related activities such as precepting and teaching, but keep in mind that no more than 8 hours per week can be spent in an administrative capacity. Another thing to note is that a few disciplines such as OBGYNs, pediatric dentists, and a few others are required to provide a minimum of 21 hours per week in direct patient care. They must still work a minimum of 40 hours, but only 21 of those hours need to be spent providing direct patient care. So a little bit less for those disciplines. The rest may be spent in administrative capacity. Now looking at the half-time applicants, the grantee must work a minimum of 20 hours per week. Depending on the discipline, the grantee must work a minimum of 16 hours per week in direct patient care. No more than 4 hours may be spent in an administrative capacity or be spent performing practice-related activities. As I just mentioned, there are some disciplines, as stated, where the grantee will be required to work a minimum of 11 hours per week in direct patient care instead of 16 hours in direct patient care. And the rest of the time may be spent in an administrative capacity. Again, this is relating to half-time applicants. This only relates to OBGYNs, pediatric dentists, geriatric servicers, and mental and behavioral health care providers. We will be verifying that you are meeting the minimum required of hours related to your discipline when we review your application. All right, the SLRP award amounts. So one major change here is that the maximum commitment will be for 2 years. An awardee participating in a 2-year commitment as a full-time grantee will be awarded up to $50,000. For half-time grantees, the maximum award they may be awarded is $25,000, also for a 2-year commitment. In the past, there have been contracts with a 4-year commitment, but that is not the case for this cycle. Right, eligible debt. To be considered eligible debt, these loans must be government and commercial loans obtained from qualifying lenders for undergraduate and graduate health profession degrees. So we do request that you provide us with a copy of your most recent lender statement in order to verify that your loans are in fact eligible. As a reminder, they must be educational loans. Please note that if your loans have been consolidated under a new lender, we will require additional verification, as we will need to verify that the consolidated loans maintain their eligible debt status. So in order for a site to be considered an eligible SLRP practice site, they must be a public or private not-for-profit entity. The site must also be located in a federally designated HCAI or a FQHC. So this is usually the area we get a lot of questions during the application process. If you're unsure if your site is located in a HCAI or a FQHC, you're welcome to email us at the SLRP email, which we will share at the end of the presentation. Right, grant agreement deliverables. So as I had mentioned earlier in the presentation regarding EVFs, if you are chosen for the SLRP, grantees will be required to submit an EVF every 6 months or as requested by the program officer through the e-app to verify the hours worked and days missed. It lists there that you will be submitting through the e-app, but there is a chance that that won't be the case. So if there are any adjustments made, we will make sure to notify you at that time. And at the end of your grant agreement, you will be required to submit documentation of payment made towards your eligible student debt. So these documents should be submitted within 30 days of the grant agreement date. A couple communication requirements. So please note these specified timeframes for reporting any changes. So you are to immediately notify us if you are no longer employed by the approved practice site. Again, this one you will want to immediately notify us if there are any changes. You are to notify us within 30 calendar days if you make any changes to your personal information, such as a name change, mailing address change, and so forth. You will also need to let us know within 30 days if you will be changing practice sites or if you plan to go on a leave of absence. You are to notify us within 60 calendar days if you go on a parental or adoption leave, or if you request to switch from a full-time status to a half-time status. Please note that you will be allowed to be away from the SLRP approved practice site for no more than 35 workdays per service year. If you miss more than 35 workdays in a service year, we will extend your contract end date for each day of absence. Please note that this is per service year and not calendar year. All right, SLRP breach. So a breach happens if a grantee fails to start or complete their service obligation. Please note that you will be required to pay any amount paid by HCAI, as well as being responsible for the number of months of obligated service not completed. The formula is stated on the slide, and you can also find that formula on the grant guide. An important thing to know is that the amount HCAI is entitled to recover shall be no less than $31,000 plus interest. Even if the breach formula results are lower, you will still be responsible for at least $31,000, if not more. If a grantee is breached, they will be responsible to pay the total due within 1 year of the date HCAI determines that the grantee went in breach. We, of course, want to avoid any breach of contract, and that is why we put into place the specified timeframes for reporting any changes. So please communicate with us if you are having any issues in completing your service obligation. We are here to assist you, and we welcome any questions you may have regarding your contract. All right, so we have provided you with the SLRP website link where you may access the grant guide, the application, and where you may also find our contact information. If you have any questions, please email the SLRP inbox, which is slrp@hcai.ca.gov. We highly recommend that you review the grant guide in detail, which can also be found on the website link and will be in the chat as well. So thank you for your time and for being here. I will now pass it back to Chris, and thank you very much.
All right, thank you so much, Daniela. As you can see, this team has worked really hard to put this program together. Right now, we're going to transition to our question and answer session. The chat option has been open and people have been asking questions. We're going to answer those questions in the order that they've been received. And we'll do our best to get to all the questions that you have today. Right now, I'm going to welcome Matthew Garcia back on, and he's going to help us answer the questions. The first question today is, Matthew, are you there for help and answer? We've got Matthew Garcia, our program officer.
Yes, thank you.
All right. Excellent. Thank you for joining us, Matthew. First question, what about registered nurses?
Thanks again, Chris. Yes, my name is Matthew Garcia and program manager. With regard to registered nurses and most cases, a fully licensed discipline is required. We do know that there are some cases where some disciplines don't necessarily have a licensed in the name, such as registered nurses, and I think SUD counselors. So in that case, we would take whatever your valid license is.
All right, thank you, Matthew. Tara asks, do you have to be licensed to apply for this, or can you be an associate?
Unfortunately, with the SLRP, you are required in most cases, again, to be fully licensed. Associate level disciplines would not qualify, and you would need to be licensed at the time of submitting your application.
All right, thank you, Matt. Stephanie asks, the HCAI contract starts March 2024. Does this mean hours don't start counting until March 2024?
Yes, that's correct. With regard to your service time and number of hours worked, we only consider for the SLRP any time worked from the start of your service obligation until the end of your service obligation. So if, for example, you're going to be part-time currently, and if you're going to be full-time by the time March 1st arrives in your application, you would be able to submit that you're a full-time employee. And as long as you maintain the full-time hour requirement, we would consider you full-time at the time of your start obligation.
All right, thank you, Matt. Next question, Jessa Lara says, really grateful for this program. In regards to the 21 direct patient hours required for mental health providers, what happens if you're not able to see the required 21 patients because of patient no-shows or late cancellations?
Well, thank you. We appreciate that, and we very much enjoy this program. With regard to direct patient hours, when you submit the EVF hours are based on a 6-month period of the average amount of time spent. So in the case of 1 week, you may have 20 hours, but the next week you may have 23 hours. That would average out to about 21 or 22 hours on average per week worked. So we do take the average amount of hours worked, and as long as you're maintaining the average amount of hours per week worked, then you would be fine and you would be considered full-time. If it is consistently less than the number of hours worked and the average is below that 21 minimum, then you would definitely want to contact us, and we may need to revise your grant and consider a half-time status change at that point.
All right, thank you, Matt, for that answer. Tara asks, how do you qualify as a mental health counselor? I am a therapist on an inpatient unit. Does that qualify as a mental health counselor?
That's a good question. That I might bring on our manager, Nathaniel Dixon. He may be able to answer you. He's a bit better versed as far as the specific disciplines. So I'll pass that to him, and he might give you a better answer than me. I'd hate to steer you wrong.
Yeah, Tara, unfortunately, mental health counselor is not on our list of eligible disciplines. For mental, we do allow licensed professional counselors, health service psychologists, and, in some inpatient unit cases, you may qualify as those, but mental health counselor specifically as a discipline is not eligible for SLRP.
Thank you, Nathan.
All right, thank you. Next question. Let's see. What criteria are weighted most heavily in considering applications?
As far as the weight of applications, we don't necessarily weigh anything over one thing or the other. As far as if you have more of one thing, we do look at your application as a whole. We look at the location that you're in. We look at the services provided. There's a variety of criteria that we use to assess your applications. And I don't want to say having one thing over another is better or not, because that's not always necessarily the case. We do our best to be as fair as possible in every regard, and everything input into your application is considered when making final decisions.
All right, thank you, Matt. And another thing to note on that is you can always reference the grant guide for scoring criteria. It does lay out specifically the process for scoring in there. Next question. Is there a word limit requirement for the description of duties on the employment information portion of the application?
No, there is no limit to what you can provide. Obviously, the more detail of what your job and duties entail, we always appreciate and prefer. But we don't set any sort of criteria as far as the limit goes on that. But we do ask that you be as descriptive and put as much of what you do as it relates to underserved communities and in your practice site as possible.
Sorry, I do want to chime in there, Matt. There is technically a character limit. It's like a technical limitation. So it's not necessarily that we have a word limit in terms of scoring or reviewing your application or anything. And in fact, the description of duties isn't one of our scored criteria. This is used for reference and informational purposes. But the system does enforce, I want to say, a 4,000 word character limit. 4,000 letter character limit on the description of duties. You don't necessarily need to feel like you need to fill that up. You know, as you can be succinct and accurate in your description of duties in less than that, feel free to use less space. Again, that's for informational purposes. It's not a scored criteria for the application.
I did notice that there's a hand up, Lori. If you're able to use the chat to ask questions, we would appreciate it. If you're unable to access the chat, you can also go ahead and email slrp@hci.ca.gov, and we can get that question answered for you. And next question, will there be more information about what is considered accepted administrative time for mental health providers?
We always, again, we recommend going through the grant guide, as it oftentimes will offer a lot more detail than what we're able to present in these webinars. We strongly encourage that you review that. The way we essentially define it is any time that is not spent with direct patient care. So any time that is not directly related to you and another person, we would more than likely consider as administrative time. There are some telework options that would also contribute to direct patient care time. However, again, the basic criteria is that any time that is not directly related to engagement with patients would be most likely considered administrative time.
Thank you, Matthew. Are there any other questions out there today? Is there great questions that everybody's asking? Again, want to make sure that everybody has seen the reference material. We have the website, the grant guide. We also have the slide deck and the email that you can contact us with. Reposted that in the chat in case you missed it. Any other questions for today? Just so it says, thank you for answering my questions.
Thank you. Thank you for being here. We appreciate it, and we're here to assist. So I'm glad we could do so.
All right. Well, if there's no other questions today, we really appreciate you participating in the question and answer session. If you do have more, please email slrp@hci.ca.gov, and our team will get back to you as quickly as they can. As a reminder, we will post the recording of this webinar on our website in approximately 7 to 10 business days. We really appreciate everybody joining us today to learn more about the California State Loan Repayment Program. We're excited to be able to offer it as part of our health workforce development efforts at HCAI and are grateful for your participation with us today. Again, the screen provides some of the links for the resources that are available. We encourage you to go to our website to read all the resources, including and especially the grant guide and the application portal. As a reminder, the application closes September 15th, and we really look forward to your submission. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful